Hello friends, uh, I'm Dr. Diptanshu. Today I'll be speaking to you about developmental delay. So what exactly am I talking about? Today I'll be covering about normal development in a child. Just a minute. Today I'll be talking about normal development in a child. How delays and deviations are occurred and uh, how exactly should we detect it and what we should do about it. So, what is development? It is the maturation of function, acquisition of skills, achievement of different functions. Uh, Overall, it can be grouped under uh, gross motor, fine motor, language, social, and cognitive development. So, basically, when right from the birth, we grow, we develop, and there are various stages. Each stage has unique characteristics and it should follow a particular course. Uh, in case of child, there are various stages, various reflexes that should be present. Uh, if those reflexes are present, we consider the child to be normal. On the other hand, if those reflexes persist beyond a particular age, that is going to be considered abnormal. A normal child, as the child develops, starts reacting to the mother. When you smile at the child smiles back. This usually happens by 2 months of age. Thereafter, the child is able to gradually sit up and then stand on its own. So normally, the child's neck steadiness should come by 4 months of age. Uh, the child should be able to sit independently by 8 months of age and should be able to stand independently by 12 months of age. These attainment of these milestones is very important. And if this does not occur properly, it indicates that the child is lacking and uh, ultimately the child is not growing properly as it should. Now, the basic consideration here is the child can see properly and hear properly. If the seeing and hearing are not appropriate, ultimately there would be problems and the development would not be proper. So, right from the beginning, when the child is in its infancy, uh, the development progresses. The child enters in its childhood, then puberty, as well adolescence, and finally adulthood. Now, if the child is not following the track it should, we'll have to understand, evaluate what exactly the problem is. Uh, the This could be due to a maternal infection. It could be due to infections early in the pregnancy. Uh, these are torch infections. The full form would be toxoplasma, rubella, cytomegalovirus, herpes, and certain others. It could be a effect of radiation, alcohol, various teratogenic drugs. It could be due to inadequate flow of blood through the placenta, and there could be other syndromes involved like Down syndrome. There could be a wide array of metabolic syndromes, and there could be others that are not genetic, like hydrocephalus. These could have played a role. Now, these are basically the factors that I just mentioned. These are before the child is born. On the other hand, when the child is born, factors could play an important role. Most important among them is prematurity. If the child is born before its time, there could be a problem, and uh, the child, when it's born, it's not adequately mature. Uh, on the other hand, if the child is born at a particular time, uh, by that time a certain amount of development should have occurred. If the child is small for gestational age, we call it intrauterine growth restriction. So that could be an important cause. Asphyxia, that is lack of adequate oxygenation. If the child is not able to cry at birth, this is very, very serious, and this can cause paucity of oxygen in the brain, thus affecting the normal brain development. Uh, there could be traumas, infections also involved in case of a child. And if the bilirubin rises high, that could also impact the brain. There could be deposition of bilirubin in the brain, causing the brain to malfunction. There are other things that are postnatal. Postnatal means after birth. So the child could have CNS infections, that is, uh, infections of the central nervous system. It could be meningitis, it could be encephalitis. Encephalitis means infection of the brain. Meningitis means infection of the meninges or the covering of the brain. The child could also suffer from trauma after birth. Once again, the lack of oxygen could occur after birth. There could be lack of uh, uh, sugar in the blood, and this condition is known as hypoglycemia. The brain needs oxygen and glucose to function. So, if any one of them is lacking, that will cause damage to the brain, and that could ultimately affect the development of brain. Now, the brain controls the development of the entire body, how the sequence of development occurs. So, if the brain is not functioning adequately, if there's a damage to the brain, ultimately there would be problems and there would be delayed development. Uh, there are other things that are not so worrisome. So the child could simply be a late starter. Often there are parents and grandparents who mention that each of the uh, children of their family have been late in starting. But this is not to be taken as a norm. It could be familial, but we'd not take it for granted. There could be global developmental delay. Global means developmental delay in all the parameters. So it could involve the uh, normal gross motor development, which covers the child's neck steadiness, the child sitting, standing, gross motor movements. It could also involve fine motor movements, and it could also involve other domains like cognitive, which is the mental development, as well as the speech. So, if these occur, it could be indicative of mental retardation. That is, when the brain is not adequately functioning. It could also happen due to deprivation of social and emotional what should I say, stimulation. Uh, there could be other things like cerebral palsy, visual defects, speech and language disorders, uh, autism. Autism is a very important thing that is coming up these days. Unfortunately, within this short span of time, I'll not be able to cover autism in details, but it is a neurodevelopmental disorder that is worth considering. There could be specific learning disorders, and there could be ADHD or attention deficit hyperactivity disorder. So, how should we find out? The first is details of the pregnancy, whether the pregnancy was fine, whether proper care of the pregnancy has been taken, which we refer to as antenatal care, whether the delivery has been hospital delivery, or whether it has been delivery has been conducted at home, whether the child cried at birth. whether the child is following the set pattern that should be seen. Or in case various things like autism, we see developmental regression. That means when the child is already achieving a milestone, ultimately it's losing the milestone after having achieved that. Definitely, proper assessment of hearing, vision, and speech and language is important, and clinical assessment is also important. There are various assessment scales which could be applied to see whether the child is following track. This is the Trivandrum Developmental Scale, TDSC. It shows that by slightly more than 3 months of age, this is the scale is in months. So the child could develop social smile right from the day one, and it could develop up to something like 3.5 months. If that does not develop within this time, it indicates a delay. Similarly, ranges are given for each of them. These are standardized, and if the uh, development does not occur within that stipulated period, possibly there's something wrong, and we need to contact the doctor. There are other scales like Lucknow Developmental Screen, which gives out the developmental parameters in similar nature, and these developments could happen by that set time. There are other developmental scales. I'm not going into that. These help in determining whether your child is on track. If that does not occur, we'll have to evaluate what is the cause, and most importantly, we'll have to administer proper supportive care to the child. Uh, there could be tests like karyotyping, which is basically assay of the chromosomes, or a technique called FISH, which assesses the chromosomes to see whether there is Down syndrome. There could be other things, other genetic techniques like MLPA, clinical exome. It's very important to check the thyroid status of the child, because if thyroid, uh, if the child is hypothyroid, that is going to affect the brain development. There are other metabolic disorders. For example, in our each of the cells, there are various biochemical processes going on. If that does not happen properly, uh, ultimately that will cause problems. And if that is suspected, we'll need to go for a proper checkup for the same. There are other things like ultrasound of the brain. Since the uh, skull is not completely formed, since there are gaps within, we can do a ultrasonogram of the brain, which is referred to as neurosonogram, and MRI can also be done. These can yield various important clues about why the developmental delay is occurring. And based upon the assessment, we can see whether the developmental quotient or social quotient, that is the quotient of social development, or the IQ, intelligence quotient, these are on track. If the chronological age, that is the age of the child in years, matches the development of the child, then the IQ or the developmental quotient is fine. If that does not occur, that means that there is delay. So in that case, we'll have to stimulate the child properly. Uh, what exactly do we need to do? It's important to give folic acid to the mother. This should actually be done before the mother knows that she is pregnant. So we call it engagement pill right from the period when the mother is, when the lady is getting engaged. She should start taking folic acid. If that does not happen, by the time she detects that she is pregnant, probably major portion of the development will already occur, and there's a condition called spina bifida, which can occur due to inadequate folic acid. Uh, Proper perinatal and antenatal care, which is the care of the pregnant woman, is important. Right now, prenatal diagnosis can be done, and that will help us understand whether the child has ominous conditions like Down syndrome. If she suffers from infections, that should be detected early and managed early. There could be other metabolic derangements like, and that includes high blood pressure, various other conditions in the mother. Those need to be taken care of. The child hyperbilirubinemia is also important. Uh, Metabolic screening of various conditions like phenylketonuria can be done. And these are treatable conditions. So if detection is done early, we can intervene early and save the child from disabilities. Uh, Down syndrome is basically a chromosomal condition which can be detected in the pregnancy and prevented. So this is very important. This is the child with Down syndrome. Uh, let's go into the various parameters. First thing is motor delay. Motor delay means when the muscle related developments are lacking. The development could be right in the brain, it could be in the spine, it could be in the peripheral nerves, that is when the nerves come out from the spine and go to the corresponding body parts. It could be at the junction of the muscle and nerve, or it could involve the muscles as well. So depending on where the problem is, it's very important to intervene early to stimulate the child so that the brain development goes at par. And uh, this physical therapy is of utmost importance. If you stimulate the child properly in every aspect, the brain will gradually take up the task and ultimately the delay will get resolved. There could be delay in speech. This is also very important. First, we'll have to understand whether the delay is in uh, hearing due to hearing problems. If the child cannot hear naturally, the speech will not develop properly. Uh, this could also be due to mental retardation or autism. Uh, Based on that, various therapies would be important, and these need to be begun as soon as we can. Uh, Delay in cognitive development, or as I mentioned about mental retardation. Uh, this is important to be addressed. We need to teach the child the way he or she can take up, depending on how sharp the child is, uh, based on how uh, easy we can present the things to the child. Uh, this developmental delay is not very uncommon. Incidentally, it's seen in more than 10%, about 20% of the children. So this is not uncommon, and this covers behavioral problems as well. So the first thing is, can we prevent it? By prevention, we mean proper care of the mother, uh, antenatal care, uh, care during childbirth, and care after childbirth. As we had mentioned, the uh, prenatal, perinatal, and postnatal factors. Whether it is gradually increasing and whether that is treatable. If that is treatable, we can resolve the problems by uh, starting early. So ultimately, in a nutshell, that is all. I did not take much of your time. I'm open to further questions. Uh, if you have any queries, do put it up. I'll be happy to answer.